The CABANA trial is a very important trial because it's set out to answer what is the efficacy of catheter ablation of atrial fibrillation vis-a-vis contemporary medical therapy. Even though the primary endpoint on an intent to treat analysis was not met, I think a deeper dive into the data is warranted because it shows that those who got ablation after the high crossover rates did actually benefit. So even in the intention to treat, there was an improvement in the key secondary endpoint, as well as an atrial fibrillation recurrence, certainly in symptoms. And for my patients who are symptomatic despite drug therapy, I definitely say ablation is safe and very effective. I think the two key takeaways from this is atrial fibrillation works. Certainly more people who had atrial fibrillation ablation stayed in sinus rhythm at the end of the trial than those who did not. So that's number one message. If you're symptomatic and you've failed drug therapy, this is a very valid option. The second thing is in experienced hands, atrial fibrillation ablation is very safe, under 1% complications. Certainly any of the life-threatening complications that we worry about were not seen. There was no esophageal fistula, and there were very low rates of tamponade or pulmonary vein stenosis. So when I'm talking to patients, I tell them this is definitely a very good option for atrial fibrillation if they are symptomatic with it.